Turn it up. Hi.
Hello.
We're back.
Yes, after another, I was down again. It got me again, Bill.
You got to start using the creams on your beehole, like I told you.
Dude. I need to do, I'm willing to try at this point.
I'll help you. I will help you.
Because I've been sick so many times this winter.
You've just been getting kicked in the peaches, man.
I have been. It sucks, too.
It was more precautionary, though, right? You didn't go full on.
No, exactly. I didn't want to spread any pestilence to you guys, too, doing the podcast here.
We appreciate it.
Yeah. But, whatever. It's one of the many viruses going around. Yeah, I kicked it pretty early, but, dude, whatever. It's just so annoying.
Yeah.
Anyway, thanks for everyone for being patient. Sorry about that.
Yeah, we had some questions come in. Mm-hmm. We're not going to get to all of them.
Right.
But there's a couple we're going to get to.
Okay.
There's especially a interesting little... it's not a question. It was someone made a statement on one of our previous episodes.
Oh, here we go.
And I kind of want to just get your opinion. I have my own little opinion.
Okay.
Would be interesting. Anything you want to mention before we get started? Honorable mentions?
Well, I have a topic, but we're going to wait on that.
Okay. Does that have to do with your significant other?
Oh, man, you're just going to get me in trouble.
Maybe
later?
What?
No, since you brought it up
organic?
Right now. Yeah, it's certainly not organic at this point. What's going to be organic is the butt kicking that we're both going to get. That's what's going to be organic. My very talented wife, Carrie.
She's been on the podcast a couple times.
Yeah, really great doctor. Also got promoted to black belt last week.
Pretty serious.
Very much so, and she is suffering from imposter syndrome right now.
Yeah.
Like most of us do, especially at that level. And of course I'm biased, but I think it was deserved. Mm-hmm. But for sure. That's just me as her husband, I'm sure, but as another black belt. But, I told her, I'm like, our professor is not one to promote people unless they're showing him things he wants to see.
Right. Yeah, so. He's got a pretty, I would say, I won't say rigid, but he knows what he wants to see out of his every level.
For sure. And we talked about that on our last one when we were talking about promotion. Yeah. So that was very cool. Obviously, I'm super proud. So.
Yeah, it was a super cool moment seeing you guys sob like little babies.
Oh, for sure.
Bill.
Well, I mean, yeah, it's true.
Was sweet.
It was true. Yeah.
I mean, I was sobbing too. I just wasn't on camera.
So that was awesome.
That was cool. So congrats to Carrie.
Yes.
So we had a comment on, we had an episode talking about jiu-jitsu concepts and are they worthless or and all that.
Sure.
And we had someone just make a kind of a not off the wall comment, but a poignant comment that says from Ryan Thompson, shout out. I would argue anything but live positional goal-based focused sparring or just live rolls is a waste of time. So once again, anything except for positional sparring or goal-based focused sparring. So obviously, like when I spar, I'm only gonna I'm going for this, right? Like,
sure.
Or just open rolls is a waste of time.
Yeah,
What say you?
I think that's a very provocative statement.
Ooh.
To engender some controversy, I'm sure. Obviously, that's preposterous, that statement.
Okay. Go on.
I think there's a ton of value in what he said as far as the value of that type of training.
Right.
The problem is, like I said, having some conceptual underpinnings for these positions, and then how are you going to troubleshoot your way out of it when you're having a problem?
Okay.
Are you just going to is it just like, well, I guess I'll just figure it out eventually, as opposed to like, hey, gosh, I'm have this in this position, in this goal, I'm having this problem. You're just going to keep doing it until you figure it out? Or are we going to try to sit back? Let's reverse engineer some things. Let's say, are there some concepts that maybe could help you?
I think the way you're talking about is actually a little bit of the ecological style, which is they will figure it out on their own without slowing things down.
No, but that's what maybe.
Right. No, I'm saying that's kind of what he's
saying. Yeah. No, I got that. And I just, anyone says anything else is a waste of time, I'm immediately going to say it's bullshit.
Right.
I'll just say, but maybe come on, and I don't know how serious he is in that, or if he just wants to kind of throw a little bit of
a little dart,
a little like, hey, what do you think about this? Yeah. Hey, anything else sucks. It's like, well, that's nonsense. Of course, there's all kinds of ways. I mean, we just had on Saturday, Professor Muhammad came in, and we did a lot of drilling and stuff, just conceptual stuff, not necessarily on this specific position. Like here,
right?
So any of those absolute statements are nonsense. I do think there's a lot of benefit, though, into positional, goal-directed sparring.
What if someone said doing heroin is really bad for you? That's kind of like an absolute statement.
Yeah.
Would you agree?
There are certain things that I think are probably, for most people, probably very, probably not a good life decision.
Okay.
Knowing the consequences of perhaps...
Right.
Yes. Now, I'm very libertarian by nature.
Right.
So if you're not hurting anybody else but yourself,
right,
it's a freak. Do what you want to do. Yeah. But, for most people, it's probably not a good life decision.
Yeah. We met one of those people when we were getting our pad thai today.
You said it was a streetwalker.
Yeah.
Not what we think like a zombie.
Yeah. Yeah, we call them walkers.
Daywalkers. Daywalkers, yeah.
And they were just...
with the mouth and the... Yeah.
Yeah, and then walked up to our car door as we're waiting for our food and tried to open it.
You know what? This is a person that probably only does positional sparring.
It's very true. I could see it in their eyes.
They are very goal-directed, trying to open your door.
Yeah.
So
oddly, last week we also had one of our newly minted purple belts with a fresh visa.
Well, that narrows it down, doesn't it? Maybe his name is Nikita.
He was at his kid's hockey game at the Angel of the Winds. What is that venue in downtown Everett?
Yeah.
And one of the parents was getting mugged, by a transient fella, walker.
Fantastic.
Yeah, was trying to break into their car. I can't remember. He was texting me about it, but he had to run up on him with that purple belt in his hand.
I thought he wore it in general.
Well, he did, but he had his trench coat, so he had to let him know because it was kind of chilly.
Yeah, he usually wears it around town.
Exactly. So he was.
Look, man. Yeah, exactly. So
okay, so I would say his comment. I agree to an extent.
Oh, whatever.
I agree to an extent, because I also agree with you that if you are troubleshooting something, you're going to have to slow things down.
Yeah.
And slow the intensity of the reactions from your partner down. Okay. So, and maybe he's actually not even saying maybe he's including that, because that's still kind of positional sparring, just with less intensity. Okay, I'll give him that. But when you are introducing a brand new move, for example, today, this is the second day we've done this move, but in the day class, we were doing an overhook from butterfly guard, okay? And then I put him in, essentially it's a omoplata. So as you fall back, you frame the head away and you go into an omoplata. 10th planet, they call it the carny, because you're hooking the far knee with your bottom leg.
Makes sense.
Kind of like this. So they can't roll. Well, sometimes you lose the arm, the omoplata arm, and it comes out front because they did a good job of unwinding it. Now the arm is at the front of your chest. So if people can imagine this, I went for an omoplata, their arm came out, and now the arm is sitting as if it was on your chest, right?
Into a back take from there.
You can go arm drag, back take, a bunch of things. But we're anticipating that we're in an omoplata, so the heel is already over the shoulder. So a back take could be kind of a little clunky, but it's still there.
Yeah.
But instead of that, I showed what if the person got their arm free, but they were really good about circling around your leg now. That little leg that you were hooking, now you're in a really bad spot.
Yeah, you are.
Hopefully you get a lasso or something.
Yeah, maybe.
Difficult. You're basically past. Well, what I showed was instead allow them to start coming around the corner, burrito grip them, which is essentially grabbing their wrists like this, or you can do interlock. Eat the burrito. So yank that hand towards your mouth. Hook, as they come around, you'll be able to hook underneath their chin. Because they're almost allowing their heads coming around.
I can picture it.
And then your right leg, if I had my left leg as the omoplata, my right leg, I extract it with my knee straight to my chest. I don't go wide. And then I latch over the shoulder.
Okay.
Essentially where my foot is.
Yeah, got it.
It looks like they're in a gogoplata almost. But then you apply arm bar. Don't squeeze the knees. Flare your knee. Okay? That's a goofy, unusual position.
Right.
If I try to teach that, I show the move for 10 minutes because I'm long-winded and I tell jokes and it's like my comedy routine.
Oh, I know.
And then I say, okay, now we're going to do it in positional sparring. If I had purple belts and brown belts that were very clunky with the position.
Yeah.
With a cooperative
exactly
uke or partner. We had to walk through this scenario and even the reaction, because what I'm teaching with this like overhook thing is a lot of specific reactions. If they're in like that butterfly with an overhook or entangled arm, whatever you want to call it, where they go thumb up to extract, the mirror lock. They just try to pull out, shotgun. They go palm down, thumb, or palm up, thumb down, omoplata, right? So depending on what the partner does, there's a very specific reaction. In the very beginning, there's so much feel to a shotgun armbar.
Dude, yeah.
You have to
depending on the length of the arm, your body. I mean, so many things with that.
Which is something we ran into. We had Sarah partnered with Lewis. Lewis is 6'2", maybe?
Yeah.
6'3".
Huge discrepancy in limb length.
Yeah.
Yeah.
Sarah is probably 5'3" or something like that. So they had their own issue doing it. She couldn't hook the far leg. Right. So she's like, well, what the heck do I do? So that's when I showed, well, this arm bar is actually right there if you can't hook it. Anyways, the point is, I think there is a place, and it's not a complete waste of time, to slow things down, address positions and movements, especially at the lower levels. I would say at the higher levels, like you're going to have passive drilling less. And you'll be able to move on to more intensity in the defense and stuff like that of when you're drilling. But to say that it's completely useless.
That was the problem I had. That's the only problem I had. I think it's a very useful thing. Yeah. What he said. If someone says something's completely useless, everything else is completely useless. I'm just turned off at that point. Yeah. If they're just being funny, that's one thing. But if
drilling was completely useless?
Well, anything but what he said. It said it's completely useless.
Passive drilling.
Yeah, but I don't know. I always think of like other sports, like every sport, basketball, football, they all do drills all the time, right?
Well,
they're advanced as they can get in the NBA. Like, how many 3-pointers do they just
develop? Free throws,
developing motor patterns that you may not use otherwise, left to your own devices.
Exactly, you're trying. Exactly, that's what I was thinking. Is like the mechanics of the position in which you're trying.
That's a great point. Yeah, and these are, people get paid a lot of money to train.
Absolutely.
These professional athletes. And I think maybe we mentioned in that episode was the judo and wrestlers, Olympic level. Judo even higher and harder to get to the Olympic level than wrestling. And Kalabib even admits that for the wrestlers out there. But like ask a D1 or just high level wrestler, how many shots have you taken? Like single legs, shadow wrestling.
I bet you they can't even. They couldn't even
It's
estimate.
ridiculous. And even like Olympic judo, like fit drills, I've mentioned that before, is they're just practicing this one sharp movement.
The problem is, and to your point, Olivia, left to your own devices, if you don't have a motor pattern, you don't have a motor pattern.
Yeah, true.
And it's hard to just all of a sudden, like, to get around this in real time, I'm going to develop a new motor pattern that you may not come naturally to you. But over time, whether it's flipping a hip around, it could be a variety of things.
Right.
then you're able to then apply. That's where the conceptual and developing these different patterns comes in with drilling. Then you're able to apply it to a situation creatively.
Yeah.
And so I have no problem with what he said, except for everything else is a waste of time, which I think that's a bullshit statement.
You're saying Ryan Thompson's a little B.
No, I'm not. I'm just saying that statement's, I'm not doing a character assassination. I'm just saying that statement's bullshit.
Ryan, I don't think you're a little B.
You're a borderline personality is what you are. You're trying to start crap, right?
So at the same time, people can fall too much on the other side.
Yes.
Which is only passive drilling.
Completely.
No situational sparring. No, what he's saying, goal-based sparring.
Absolutely. And I agree with that too.
Yeah.
Yeah.
You don't want to go where that's all you're doing.
Just this,
as well.
This whole binary, like it's either this or this. Everything else sucks but this. It's just like, come on, man.
Yeah. How many genders are there? I'm joking. What?
I feel like there's more.
Give me an ass.
I feel like there's more of an issue of people not drilling enough than people drilling too much.
Dude,
you know what I'm saying?
sparring's fun.
But yeah, exactly. And that's why I'm saying,
on.
like, I don't think that most people err on the side of I'm only going to drill.
No.
I think more people err on the side of I just want to roll, which then makes it so that they're not able to really tighten up.
Totally.
Their
And there's
technique.
something to be said for self-discovery and getting into a position and figuring some stuff out. That's awesome.
Yeah.
But saying everything else is worthless.
And the thing is, I think
dumb.
The amount of time you need to put into quote unquote passive drilling or just drilling where the partner's not giving a ton of reaction is less than people think. Yeah. I think you can move on from that phase pretty quickly.
I agree.
Especially as you're more advanced in skill. But to think that there's no place I think is
how many people as a white belt with guard retention, when someone's coming around and throwing a leg, how many people have that in their motor pattern to flip that opposite leg around and hit the shoulder with it?
Right, yeah. The cross step.
The cross step. Yeah. I mean, there's some things that are just, anyway. Yeah. I think we beat that one to death. And it's a bullshit statement.
You're dead, Ryan. You're dead.
One more thing. If AOJ does drilling, then I'm doing drilling. Yeah. Because they're
keep Hoffa's name out your mouth.
Yeah. Okay. The best out there.
Wow. Wow. I like this controversy.
You had a topic that you have not told us about that you wanted.
Yeah, and anything else but this topic is complete waste of time, by the way. So everything else.
We'll delete the first half.
Okay. So in all seriousness, one of the things about being a doctor in a jiu-jitsu academy, especially a musculoskeletal medicine type of guy, is that, and I welcome this, please don't stop doing this, everyone. This isn't a hint not to. But I have people coming up to me all the time like, hey, man, I got this thing going on or this thing going on.
I got this spot on my ass.
Yeah. I know. We've talked about that. So
all right.
That's probably a whole podcast talking about your ass. So I don't know. It might take a long time. But biggest thing is shoulders, man. Okay. Shoulders and necks together. And what I wanted to talk about is how we use our outside time for training. I think most of us, it's not doing us any favors to prevent shoulder injuries. Okay. And I'm not saying to stop doing the strength training you're doing. I'm sure it's fine. But I would also definitely incorporate stabilization type exercises. And what does that even mean?
Yeah.
Okay. The shoulder joint, otherwise known, we call it the glenohumeral joint, the humerus. Yeah, it's a ball and socket joint. Okay. The shoulder, arguably, and I think it actually has the greatest range of motion of any joint, I think, in our body. It can do amazing things. You can think about what a shoulder can do. The trade-off to that excellent mobility is inherent risk of instability. And we see this all the time with shoulder dislocations and, AC joint injuries and things where the shoulder gets in wonky positions and isn't stable, right? Yeah. We see, because in jiu-jitsu, we always tell people as you're falling, definitely don't post, right?
Right.
But we often do post for frames or for, like stuff like doing a hip bump or.
Sure.
Okay. So if you think about we have these big muscles, the deltoid, and a bunch of other things that are the primary movers, really strong. to counter that, to keep that ball and socket joint stable in the joint. That's what the rotator cuff is for. People always think rotator, it must rotate the shoulder. Yeah, it can, right? But its primary job, if you think about what the rotator cuff is, it's a group of 4 tendons that grabs the head of the arm bone, the humerus, and it pulls it and stabilizes it into the socket to counteract migration of that whole ball and socket joint from the big muscles will try to pull it up and out, right? And so we need something to pull it in and stabilize that thing. We don't train that properly. Rotator cuff exercises, you see a lot of people, they're like, oh, my physical therapist showed me this is how you strengthen your rotator cuff. Most of those protocols are post-surgical.
Yeah, I was going to say, I had a severe rotator cuff sprain in high school in football.
Technically, it's a strain.
Strain, okay.
Yeah.
And like a lineman landed on me when I was getting tackled.
Yeah.
And it just like compressed.
Yep.
And they had me doing some of like a soup can
Yep.
kind of stuff.
Yep.
Like,
which is fine in the very early stages of things, just to get mobility in. But you'll see them doing external rotation, internal rotation movements, almost like Kimura, Americana positions.
I remember that, yeah.
Sure. But those are isolating the rotator cuff and their rotary component, and they're not really training the stabilization component, the pulling in, as opposed to things like side planks where you're posting on your shoulder, or you're trying to maintain that shoulder, what we call joint centration. We're trying to keep that ball and socket kind of together and not getting squirrely. And so what I think we're going to do over the next several weeks is have these little short snippets of some individual stabilization things you guys can incorporate into your training program. I'd highly recommend it. Some of the biomechanics associated with that too, because rotator cuff, the reason why it's injured so commonly is it's not trained well, first of all. And then we do things with it that make it vulnerable. Okay. And so I really think that would help our community out a lot to kind of have a little series of some exercises we can do to incorporate that.
Yeah, for sure.
For stability. And this isn't the end all be all of everything. And, different sports have different requirements. Like, I necessarily wouldn't do some of these exercises if I was a professional, like a pitcher in baseball or something. That's a different requirement, right? But for jiu-jitsu especially, and anything where with framing and posting and all that, I think it's hugely important. So we'll be doing that and showing some, but it's really important to understand what the rotator cuff does, right?
Yeah.
Primarily.
Yeah, I didn't know it was actually a whole. Can you strengthen that pull?
Yeah. That's what I'm saying. And so it's a reflex. What happens is when you do load it in a position where it makes it stabilize. And at first, some of these movements, I'm going to show you guys a bunch of different stuff you can do, and you can pick and choose whichever one you think it works well for you. But it makes it start to activate and do things reflexively, right? And we want to strengthen that, not only just strengthen, like, we don't want to necessarily like how much weight we can bear, but more that strength endurance, right? Because that stabilization needs to take place over large periods of time, as opposed to doing max weight. We want to go for more like time-based type of stuff with the stabilization, like static holds and things like that in different positions and different angles, because Lord knows we have our arms in crazy positions sometimes. Yeah. So we need to train all those angles and have the brain be able to reflexively stabilize there, right? So
I know last couple of times I thought I had a shoulder injury. It was actually a bicep injury.
Well, you can't distinguish the two. The long head of the biceps goes deep into the shoulder, actually into the glenohumeral joint. It is here's a trivia. It's the only tendon that penetrates the capsule of the shoulder. It goes in the capsule is this big connective tissue bundle that the rotator cuff is embedded in, but the long head of the biceps actually goes intracapsular.
So that's what it feels like. It's an internal shoulder.
Certainly it is. Okay. Literally it is. Even though we associate the biceps here, there's two heads of it, right? Long head goes deep into the shoulder. The short head actually attaches to the front part of the shoulder blade, right? It's called the coracoid process.
In your back?
No, the shoulder blade. See, a lot of people don't understand this. They think the shoulder blade is just that thing in the back. If you take it, do a Google search of scapula in isolation, which is the shoulder blade. Not only is it that blade you see in the back, but that the thing that the ball and socket, the socket that the ball of the shoulder fits into is part of it as well. It's one bone. That roof overhead, part of it. Okay. And it has a front attachments too. So that is a whole one piece of bone there. And a lot of people think it's just this blade in the back. It's not. It actually is the socket of the ball and socket joint of the shoulder too. It's called that's called the glenoid fossa of the scapula, where it fits. That's why it's called the glenohumeral joint. Yeah. So that'd be just to understand. And as jiu-jitsu practitioners, it's really a good idea to get some visualization of some of this anatomy too. You don't have to be a doctor or a physical therapist, but it's nice to understand this stuff.
Well, I feel like we see shoulder injuries more than, I mean, it's up there.
I see knees, man. Knees, shoulders, and elbows, man.
Maybe neck a little bit, but
neck too. Well, and we'll talk about how neck and shoulder are really interdependent, and not only neck, but thoracic spine too, which we'll talk about. Sometimes shoulder mobility issues are actually a thoracic spine.
You've been having us do a little bit of a interesting thing where we're trying to grab our.
That's right, and then I'm having you rotate. Yeah, that's to try to help that thoracic extension to help that, because the scapula floats on that back part of the back too, right? And if that upper part of the back doesn't have the requisite mobility either, you're trying to get some artificial mobility from the shoulder too. It can cause problems as well. So I'm trying to, part of our warm-ups, you can say, I'm trying to integrate a lot of this stuff in here, but I'm not going to give you guys a lecture every time about why I'm doing this. Just a little bit. But that'll be a little video series I'd like to do. And we're not going to do like, here's one video with like 5 exercises. I want to do one exercise that may take, like a 2-minute video. Then next week we'll do another one. We'll do a series of these, so then you can guys kind of look and see what you like. And what's doable. Minimal equipment too.
Yeah. Okay. Yep. That sounds good. On the next episode, I want us to talk about, last episode we talked about promotions and all that kind of stuff. But Olivia was thinking about things that we shouldn't be doing. So we've talked about things that you should be doing to help progress. But how about things that are common that we do that are actually hindering us?
Yeah, I can tell you.
Yeah,
I can tell you. There's a bunch in my mind.
Next episode, I think that will be a good topic. If anybody that's listening now has their own input, I would like to hear what they have experienced as stuff that's held them back, or that they've seen their teammates get held back by doing.
One of the things is not working on your mobility and strength in these. And like we've talked so many times, how many people they're like, oh man, I'm having knee problems. You've seen me lay them down on their back and I move their hip and it doesn't move. Yeah. I'm like, well, that's a freaking problem.
Yeah.
The same thing with shoulders and all that. So I think doing this kind of series, because that absolutely not only will hold you back, it sets you up for an injury, which will really stifle your progress.
Yeah, and I think that's
a great topic.
We'll end up touching on some physical things, like you just kind of hinted at there.
Training problems,
some training methods, mentality, mindset.
Yeah, I was gonna say,
there's going to be a whole bunch of stuff on the next episode that we're going to go over.
I like that. But anyway, that's what we'll put that on there for you guys. We'll start. Hopefully, we can get one out here pretty soon.
Yeah, we'll try to get one up maybe by next week. Okay. We'll have the first one up.
Perfect.
Another question. Long one, a little bit personal, but it has to do with the Navy and some medical.
Well, that's up my alley.
We're just going to go right into it. So bear with us, people. I'm going to read this here. So they've asked questions before, but they say, my son is 20 years old, is in week 5 of Navy boot camp. He's been doing excellent up until this point. He got a call from him, and he's devastated since he had to go to his sick bay because he has this condition on his scalp that is painful for him. He gets these pimple-like bumps that look like acne, but are bigger and actually more painful. The naval DRs, the dermatologist, says he has a condition called folliculitis.
Folliculitis.
Well, there you go.
Okay. Wow, what a brilliant doctor that is. Yeah.
Good start. He says that will most likely mean he needs to be discharged as it's untreatable.
Oh my,
That's
what
they're saying. They prescribed him a bunch of medicines since they don't know what would work. As a result, he has a choice. which is to either stay in boot camp while they send for a waiver to remain in the Navy, or opt to be discharged and figure out what to do at home. He's opting to stay in boot camp, even though from what they said, it's most likely he'll be discharged since the waiver may not be granted. I was hoping because people don't know, you have an extensive Navy background.
Yep, 13 years.
Yep, and as a medical officer, among other things, Navy diver. So he said, I was hoping you might have some guidance on other types of experts that might be sought out for any process you know of from the Navy that we might pursue. It's been my son's lifetime dream to be in the Navy, and I can see this to be very hurtful if ultimately he gets sent home for medical reasons. Am I wrong to understand that lately the more sophisticated medical advice about things like this is that it's often caused by hormones, inflammation, or gut biome?
The third one and the second one.
Inflammation, gut biome?
Yep, almost certainly. However, the first question I'd ask, has he ever had problems with this before? And probably the answer will be no. Navy boot camp, what they'll do is they'll shave your head. Guys, you get, okay. And he probably has never had his hair.
Sure.
Cut that short. I'd like, it'd be, what does his hair look like? Is it kind of thick and wiry? Is it thin? You know what I mean? All these predisposed. Folliculitis, that's why I was just being snarky about what a brilliant diagnosis. That just means freaking inflammation of the follicle. Wow, genius. Yeah, the hair follicle.
Okay.
Yeah, so it's like, okay, but it's what happens with the hair, especially sometimes if you see this sometimes with people with shaving. Like they can't shave close because the hair will then ingrow. Right. Same thing with the scalp, right? Okay. And various conditions can predispose type of hair.
I mean, he's saying they're fairly large.
Oh, for sure.
Okay.
Well, again, I'm just going with the diagnosis they gave. I haven't examined the guy.
Yeah. It could be something else. It's just,
who knows, right?
But
assuming that he's never had a problem with this before, I would argue that there's a couple things going on. Number one, the stress of boot camp definitely causes, stress in general causes an inflammatory response by the nervous system.
And then throw in the potential of being discharged.
Well, this happened before. I mean, how did it start?
Right. Okay.
Probably had his hair cut shorter than he's ever had it before. Okay. And then as it's growing in, these follicles get the so-called ingrown hair, the hair follicle itself gets inflamed and infected. And so you have to treat it with an antibiotic and just, because it's an infection of the follicle. You've seen them in your hair follicle. Yeah. It's the same thing on the scalp, but it's much more, the scalp is very vascular too. There's lots and lots of blood. You know how much scalps bleed, right?
Right.
Okay. He probably is also eating, knowing Navy food, a bunch of shit. Okay, it is.
Yeah,
I know that personally. Probably the added and I know this sounds, for people that aren't versed in this sounds crazy, but look up on Google gut skin axis. A lot of inflammation will start out in the gut. Usually due to, there's all kinds of that intestinal permeability, usually due to stress, irritants, things like that, get expressed superficially. It's probably not helping. It's probably giving more of a full body inflammation coupled with this more than likely shaved their head and then it's growing back and now he has folliculitis. This absolutely should not be a discharge thing. This is just the lunacy of the federal government anymore. It's just this, and the fact that they need people really badly in the military right now too. Right. To me, there's probably someone that doesn't really give a shit. Whoever, I don't know what medical provider they saw. They're like, whatever. There's no, there's a lot of apathy going on too. Oh, sorry, you got this. I'm not going to look any further into it. Sorry, we're going to have to discharge you. It's going to be really hard for him to adjust both stress and the diet. But, that's likely what's going on.
My first thought, putting my doctor hat on,
I like it,
was like elimination of foods,
totally,
and like going carnivore almost.
Absolutely. However, to an extent, I would say, given Navy boot camp, I would make sure you do like meat and fruit. Meat, fruit, and honey. Stay the hell away from any grain products, dairy.
Yeah.
You got to do that. I agree with you 100%. I would eliminate. I would do like the a meat, fruit, honey, just even simple. Just to replete. You don't want to go try to exercise.
Right.
You'll crash and burn.
Especially with the potential like poor sleep he's going to be getting. Totally. He's going to need some of those sugars.
So all these things are kind of added up together, I would guess. He may have a predisposition with, some like myself. I sweat a lot. Mm-hmm. I'm more predisposed to folliculitis too. The individual hair follicles, how much oil you secrete, all kinds of different individual variables as well. But like I would guess, he'd never had a problem with this before.
Right.
So then why are now we're saying, we're treating him like he has this underlying condition that he's not, and it's just like probably a transient condition that he'll never have a problem with again.
Right.
Why would they consider this enough of a reason to discharge?
Because they're idiots.
Because it's like, it's not contagious, right?
No, but so the idea is you're not,
duties.
Well,
right.
Well, folliculitis can get nasty and get an out of control infection. It's like anything else. You can get secondary infections, MRSA, anything that can, right? So if you're on deployment, it becomes an undue burden to whatever load.
Right. If he can't do his job or something.
Or you may get in a situation where he's in a liability to whatever mission's going on because of whatever. But, it's not like he has some congenital uncurable disease. And these guys are, they either don't have the education or they probably just don't care. I can tell you, I've been in, I was on the medical side and all this stuff.
It's government.
It is, man. Especially anymore. It's one of the reasons why I got out at 13 years. It's just the apathy and like, whatever. It's just like, these are people, man. And they're just, in the military, you're treated even more and more like just this commodity, right?
Yeah,
you're not even
Yeah.
And so I would say for him, I would be shocked if he didn't have an improvement if he just ate meat and fruit.
Yeah.
See how he did. I would say try stress reduction, but good luck.
Right.
It's hard during boot camp.
Could coming from a non-official like myself, could he also do this, what you're saying, but then what I'm saying is say that, things feel better. So it kind of delays any sort of discharging or paperwork.
It's not about feeling better. It's about what's visible. You see what I'm saying?
Because he could say like, "Oh no, I'm not having any pain anymore," and all that.
But it has nothing to do with pain. It's nothing to do with that. It has to do with if you see these huge
blotches and stuff.
Well, these, what these little big pimple, folliculitis looks like, right? It's big, red, angry looking stuff that's infectious. Yeah. Not contagious, but it's to him, he could get a nasty scalp infection and stuff like that related. It's just an entry to nastiness, right? Yeah. That's what it is.
Okay, I have another question. Yeah. So if they give him antibiotics, that should take care of the infections, right? And they should start to heal. Now, would it be I'm assuming he has to keep reshaving his head.
So this is the problem.
The sweat, because they probably don't have time to go and shower and clean and make sure it's, like you're talking about sweat and other things like that cause issues.
Yeah, the problem is, they do keep that whole, I haven't been in a long time. It's been a long time since I was in 91, when I was in boot camp.
Yeah.
At that time, they shaved our heads completely. Why they do that is stupid.
Why do they do that?
Huh?
Why do they do that?
It's dumb. I don't know. It's because they've always done it. So I think back in the day when people were coming in.
Oh, maybe like lice.
Stuff like that, right? But I mean, come on, But we do see this. We have folliculitis in the face too, where people are still in the Navy and they have a waiver to not shave. Because it's the same thing, right?
Yeah.
Every time they shave close, it starts growing in. And certain hair types, it's a setup for that. It irritates the skin, and then they start developing folliculitis. Why
wouldn't they just give him a waiver then not to shave his head?
You're exactly.
Is that common in the African American community?
Yes.
Because they
yes
the bumps.
That's what that is. That's folliculitis.
Yeah.
Right. It's the same thing, but on the scalp.
Okay.
Right. And so they do. Yeah, I know. You're asking a very reasonable question. And that's all they would have to do is treat it
save
and not shave his damn head again. I know.
And then you wouldn't lose
someone that wants to be in there.
I know, man. That's why I'm not in anymore.
Yeah,
the stupidity is just unbelievable. And there's still some great people in the military,
Sure.
but they're subject to this kind of stupidity.
Yeah. What do you mean, you people?
Huh?
He didn't say that.
I didn't say you people.
Oh, my bad. Well, with that,
I said there's still some great people in the military, you piece of shit.
easy. Gosh. Aggressive.
Wow. That's very aggressive.
Been hanging out. Never mind. Kind of a quick episode. We got a lot of stuff banked for actually the next episode, like we kind of talked about with the things to not do, things to stay away from, pitfalls. Like I said, I'd love to hear some other people's opinions on that. But that was kind of a quick one today. Any other questions? Let us know.
Bill's known for his quick ones, so.
You heard it here first.
Yep.
Never mind.
It's just I saw it written on a bathroom somewhere.
I have so many jokes that I just want to shove down your gullet, but I won't do it. Hit the music, Liv. We're out of here.
He's trying to stop.
I'm out of here.
Worse, dude.